Hi, I'm Fenu from St George's University of London, and I'm here to present to you our systematic review titled Outcome and Outcome Measure Reporting in Randomized Controlled Trials on Laparoscopic and Robotic Surgical Procedures for the Management of Pelvic Organ Prolapse in Women. This is a systematic review and a proposal for interim core outcome sets brought to you by Chorus Collaborations. This is a page on our affiliations. So, wide variations in outcome reportings are present within pelvic floor research. This leads to research heterogeneity and prevents the development of high-quality meta-analyses. What we suggest is the proposal or the development of core outcome sets, which we defined using the COMET handbook as an agreed standardized set of outcomes that should be measured and reported as a minimum in all clinical trials in specific areas of health or healthcare. The importance of this is to improve research harmony and increase comparability among studies. So the objective of our research was to identify variations on outcome and outcome measure selection, collection and reporting within randomized controlled trials in this field, as well as to perform an assessment on the methodological quality and the quality of outcome reporting within these randomized controlled trials. This is a slide showing previously published work by Chorus. We conducted a systematic literature search in the following databases: Embase, Medline, PubMed, and Cochrane Central Register of Controlled Trials, using the following mesh terms. All randomized controlled trials published in English that included adult female participants were included in our systematic review. We then reported our systematic review following the PRISMA guidelines and registered it on COMET using the registration number 981. Titles, abstracts, and full text were screened. Following this, study characteristics were extracted from each trial and inputted into an inventory. Study characteristics that we extracted include things like outcome measures, follow-up period, number of participants, and this formed our database. Outcomes were categorized into domains, and domains were then subsequently categorized into themes. Two separate researchers independently assessed the trials and scored them using Jadad scoring, which assesses the methodological quality, and moment scoring for the assessment of the quality of outcome reporting. There were some discrepancies, however, they were resolved using a third researcher. Our original systematic literature search produced 443 articles that we screened. 403 were excluded after the first round of screening, leaving us with 40 full-text articles that were assessed further for their eligibility. After this, half of them were excluded because they were not randomized and for various other reasons, and leaving us with 20 studies which were included in our systematic review. I would like to point out that 3 studies were excluded as they only had selected outcomes but no collected or reported outcomes. To discuss our results a bit further, 90% of trials compared 2 different types of interventions. 50% of the trials assessed laparoscopic sacrocolpopexy. 25% of our trials compared laparoscopic and robotic sacrocolpopexy. And interestingly, 10% of the trials compared the same surgical procedure with changes to the equipment. 75 different outcomes were identified in our systematic review. These were categorized into 12 different domains and 5 different themes. I would like to point out that the largest outcome domain was intraoperative technical outcomes and observations, and this domain was categorized under the adverse events theme. It has 11 different outcomes, blood loss being the most frequently reported outcome within this domain at 40%. The graph on the right shows the most frequently reported outcomes, operative time, post-operative pain, and quality of life being the top 3 most frequently reported. This table shows how we categorized our different outcomes, and we can see all the domains and all 5 different themes: adverse events, clinical effectiveness, efficacy, cost effectiveness, and life impact, as well as the number of outcomes within each domain and the frequency of each outcome reported within each domain. We also assessed the outcome measure reporting in each randomized controlled trial and identified 54 different ones. These were then divided into 6 categories. Quality of life was the largest category with 25 different outcome measures. Patient global impression of improvement was the most common outcome measure within this category. I would like to also point out that 95% of the trials included validated questionnaires. The graph on the right now shows the most frequently reported outcome measures. POPQ, Visual Analog Scale, and Pelvic Floor Distress Inventory being the top 3 most frequently reported. We also conducted some statistical analysis on our data and found no significant correlation between Jadad and moment scores, as well as these scores and publication characteristics. We think this is due to the low number of trials included in our systematic review. So a variety of outcome and outcome measures were identified as shown by the data. The largest outcome domain was intraoperative technical outcomes and observations. And interestingly, underreported outcomes include cost, only reported in 20% of the papers, sexual health, only 10%, and cosmetic outcome of the wound, only 5%. The median Jadad score was 4, and the median moment score was 5. So to conclude, we recommend the use of an interim set of outcomes using the top 3 most frequently reported outcomes in each domain until final core outcome sets can be developed. A Delphi study can help in the validation of these outcomes, and we suggest using this to minimize research waste until core outcome sets can be finalized. The development of core outcome sets for the surgical procedures will aid in future research, increasing the quality of evidence. This is a table showing our proposed interim core outcomes, all the outcome domains, and the outcomes we suggest using per domain. And this is my reference list. Thank you very much. I'm happy to answer any questions.